Allison, we're on the air. Let's welcome everyone. You're listening to Fearless Parent Radio, the Gutsy Parents NPR, where you're going to hear the best information available on parenting today with humor, honesty, and warmth. We're your co-hosts. I'm Louise Kuo-Habakis.
And I'm Allison McNeil.
Today's show is about keeping our kids out of the doctor's office all winter. How do parents do it? We're going to tell you. The call-in number is 888-874-4888.
We've got a great handout today, too, covering the information from today's show, and you can get a copy of it by posting a comment on our radio blog at fearlessparents.org.
So, Allison, did you know that it's cold and flu season?
Yep, Louise, it's November. I guess the bacteria and viruses got the memo. Come on over. It's party time.
Exactly. I mean, seriously, Allison, how ridiculous is it, right? It's November, and so it's the big cold and flu season.
Louise, why do people get sick more often in the winter?
It's a good question. So I know lots of people have their theories about this. I have the big three, the three S's. You want to hear them?
Yes.
Okay. The first one, and this is a real biggie for me, it's sugar. Okay, so on October 31st, our nation propels itself into cold and flu season with what I think is the most massive sugar fest known to man, and it's called Halloween. So, you know, for kicks, I looked it up, right? And I wanted to see, what are we doing on Halloween? We are spending $2 billion and buying 600 million pounds of candy. We're talking 3.4 pounds of candy consumed per person in this country. So, 200 years ago, and I know these are a lot of statistics, but I just want to say this one last stat. 200 years ago, human beings ate about 2 pounds of sugar per year, okay, or at least in the Western Hemisphere. 2 pounds a year of sugar. Today, it's 160 pounds of sugar a year. Is that unbelievable?
Have you ever held a 5-pound bag of sugar? Have you ever felt how heavy that is?
Yeah. Now, imagine digging in with a spoon, right? So sugar does a total number on our immune system. It seriously, it whacks the pancreas. We know it's really bad. Okay, that's number one. Number two, second S is sunshine, and we have less of it, right? Shorter days. This translates into lower levels of vitamin D. And the only thing I just want to say about this, because I know there's a lot about vitamin D out there, vitamin D is protective to our immune system, right? Most of us who aren't supplementing, we already have super low levels, and in the winter it can become a really big problem for a lot of people.
Yeah.
All right.
Yeah.
Number three, third S. Can you say stress? Gobs of it, right? Okay. Cooking Thanksgiving dinner for 18 people, right? Ordering holiday cards. Can you afford Christmas this year? You know, think about this, right? I think all three of these S's, I can feel my immune system shrinking already.
Yeah. And you've ever noticed that you'll go to a really stressful event, and then 3 days later you have a cold?
Yeah.
And now again,
that's right, especially after having done this other stuff, right, like eating all this sugar. Okay, so let's get on with it.
Okay, so who's going to tell us how to keep our kids out of the doctor's office this winter?
That's Kelly Brogan. Dr. Kelly Brogan, our medical director of Fearless Parent. Okay, so Kelly is a holistic, board-certified psychiatrist with a private practice in New York City. She's really smart. We want to brag about her a little bit. Undergrad at MIT, Cornell Medical School. She's on the faculty at NYU, and she's the married mom of 2 girls. So Kelly has invited another doctor, and they're both rolling up their sleeves to tackle this topic. And I love this, right? Okay, so 2 doctors who are moms, 2 moms who are doctors. I want to listen to this, right? They have the same goal as we do, which is healthy kids. And I want to be a fly on the wall on this conversation. I want to know their secrets. I want to know what they do in the winter with their kids and what they don't do. And I want to send this show to my friends and family who think I'm crazy when I do the stuff that I do, right? Like let a fever run.
Absolutely. Kelly is our medical director at Fearless Parent, and she is going to do today, this is our first monthly installment of Fearless Medicine. So once a month, Kelly will be tackling the controversial and cutting edge with her warmth and heart. Kelly and doctors like her, we believe, are the future of medicine, and we want you to know these kinds of doctors exist so you can start looking for them in your community. Okay, Louise, I'm going to be taking notes on this for my own kids. I'm going to talk with you about this at the end of Kelly's interview.
Terrific. Okay. Hey, Kelly.
Hi, Allison.
We're so excited. We're so excited for this show. So we're also sending a warm hello to your wonderful guest. Hi, Pina.
Hi, guys. Thanks so much for having me.
So Allison and I will catch you guys on the other end of the show. Kelly, it's all yours.
Sounds great. So I'm very excited about this very first installment of Fearless Medicine, and the goal here really is to make sense of medicine for everyone listening and to sort of see where you fit between the herb-toting hippies and the med-pushing docs, and to make sense of it for you and your family and your kids. And so to that end, I have one of my favorite people, Dr. Pina LaGiudice, and she will be talking to us about how she approaches these issues personally and professionally. And before I go into her sort of resume, I just want to say that I have so many opportunities to meet a lot of wonderful clinicians these days, and I've become really sensitive to looking for this feeling I get when I meet somebody for the first time of an openness, like a warmth and an openness, because I think so many women, and especially women in sort of clinical settings and doctors and other sort of providers, for whatever reason they can get sort of hardened, and even when they're trying to practice compassion in their offices, they don't carry that energy around with them. And I had the pleasure of having dinner recently with Pina and her husband, who's also a naturopath, Dr. Peter Bongiorno, and she just radiates this incredible open warmth, and it's so rare, and even personally and professionally it's rare for me to encounter. So she brings that in addition to being hailed as a world expert by Dr. Oz and having made multiple appearances. She's a very frequent flyer there, and she's a well-recognized expert, and I would say world-renowned expert in the field of natural medicine. She graduated from Bastyr University, which is a leading accredited university for science-based natural medicine, and she completed 5 years of training in naturopathic medicine and acupuncture. She was a predoctoral fellow in the clinical neuroendocrinology branch, which is a topic very close to my heart, and for the Institute of Mental Health at the NIH, and she researched mechanisms of mind-body neurohormonal regulation, which is really where it's at. That was my editorial detail. And she's co-author in the 3rd edition of the Textbook of Natural Medicine, and she's authored an original chapter on pregnancy and primary prevention for the upcoming 4th edition. She's on adjunctive faculty at the the Natural Gourmet Institute for Food and Health in Manhattan, and she's taught at NYU. And she has a new project called The Birth Plan, which maybe she'll tell us a little bit about before we stop. So welcome, Pina. I'm so happy to have you here.
Oh, Kelly, thank you. It's such an honor, and I have to say that I absolutely reciprocate the feeling about you. I know the thought about meeting people and understanding the warmth and the care that they truly have and emanating from within, and I just feel the same way about you, so I appreciate that.
Thank you. That's an enormous compliment. So before we talk about, get down to sort of the nitty-gritty, I want to sort of give people something of a context for sort of how you got into it. I mean, I think I've discussed how I was not born and raised this way. I was, unlike my husband, who was, born in a very sort of holistically oriented family. I came to this in my sort of 3rd decade of life, and really through the science of it, believe it or not. And I know that that's not everybody's journey, so I'm interested in sort of your path to natural medicine, and just tell us a little bit about how you got here.
Sure, I'd be happy to share that. So, and if you can't hear me okay, just let me know.
How I came to natural medicine is that pretty much with my own health journey. My whole life I was a pretty sick kid. My mom could attest that she took me to every conventional doctor there is to help figure out my issues as to why I chronically had bronchitis, why I chronically had digestive issues. And pretty much it was my whole life that I was searching for health. And it was throughout my years, of course, in the conventional medical world, I was just labeled that I just have to live with these health concerns, which to me was very disconcerting. So it wasn't until later on in my life that until I graduated college that I was studying for the MCAT and to go to conventional medical school that I came across this holistic nutritionist. And within one visit with this person, they changed my life. They changed my diet, botanicals I was taking, nutrients, and within 2 weeks I felt like a new human being. It was profound to me. So I knew that this was the type of medicine that I wanted to study, and that's when I pursued naturopathic medicine, and this is where I am. So for me, it's very powerful because I've been where many of my patients sit in terms of frustration and not feeling great, and I always try to encourage them that they do have options in their healthcare and that they could feel amazing.
It makes so much sense, and it resonates so much with me. My entry point to this type of medicine was through a personal naturopath also, and I think sometimes just that one-on-one experience shows you what is in the data, is in the literature to suggest that there is a less invasive, more effective way to get at managing chronic disease. And so I think it might be helpful for some people because I end up clarifying this for a lot of folks. So what's the difference between a naturopath and like a regular old doctor?
Okay, great question. So there's three types of physicians in the United States that most people don't know about. There's the MD that we know and love, the allopath. There's a DO, which is an osteopath, and an ND, a naturopath. And basically, it's just a different philosophy on how the body works. So when it comes to medical training, it's the same anatomy, physiology, pharmacology. So all those basic sciences are the same, but it's just a different philosophy in how the body works. Where an MD, they're taught in their medical school that the body is very system-based. So that's why you have your rheumatologist, gynecologist, gastroenterologist, and so you broke it into these parts. Where an osteopath looks at the musculoskeletal system, where if the nerves are not feeding the muscle or the organs, that's how disease or pain can arise. Where the naturopathic approach is mind, body, spirit. It's where the body is an integrated whole. So along with all that conventional medical training that we learn, on top of that we learn about diet, nutrition, herbal medicine, vitamin therapy. So all those things that teach the body, and we're learning medicines on how to support the body in healing using these least invasive methods. So in essence, it's just a different philosophy, but pretty much the training is very similar.
Yes, and that philosophy ends up being probably never more critically important than in addressing the types of things that people are dealing with today, I would say. I mean, the analogy, so basically I've spent the past 7 years of my life trying to catch up with your training, essentially, after having gotten the conventional MD, and so the analogy that's used in some of the conferences that I go to is, with conventional allopathic medicine, it's like all of these doctors are in a dark room with an elephant, right? And they're feeling, one's got the leg and one's got the trunk and the other's like up on top, and they're feeling and they're trying to describe what they're observing, and they're trying to give a picture of what they're dealing with, and they're all giving these like totally, one's like, well, it's a long tube, and the other's is like a big thing, and they're totally different explanations, and nobody's got the whole animal in mind. Nobody knows what the hell they're touching, right? And that's really what ends up happening, is how many of us know people who get shuttled around from specialist to specialist to specialist, and then they're resigned to really a life of managing their symptoms, never feeling quite right or quite well, and nobody's connecting the dots. And so that's, in my opinion, really the brilliance of naturopathic medicine. So in sort of line with this philosophical distinction, maybe it's a good place for us to start to talk about how to apply these concepts to our kids, right? Because I think that we had a sort of summit seminar for Fearless Parent. I think it was last week. Man, I don't even remember. And it was really, it's really exciting and really well received. And we talked about health in flu and cold season. And there are a lot of moms, even who are very interested in natural health, who feel scared when their kids get sick. And I think it's important for people like us to help them know what to do with that fear, how to manage it, and when it's sort of appropriate and when it's not appropriate. And maybe we can help them to understand how things like a fever may not be as scary as they're made out to be by media and the doctors that they're consulting.
No, absolutely. I mean, it's one of the biggest concerns that I know the parents have is that, they feel like when you get sick as an adult that you can kind of manage yourself, but, when you have your child, who I know for myself is my heart and soul, it's like obviously you're petrified if anything goes wrong, and especially when you're inundated in the media and in the news about, how bad fevers are and that your child could die from it, and it's this constant fear mentality when it comes to your children. It's that, of course, instantly your brain is going to snap and go right to that. And so, and especially when you take your child to the pediatric office, it's, you're feeling overwhelmed by all this constant negative information. Well, if you don't do this, your kid's going to die. So you're never reinforced as a parent about your options, about your abilities, and what you could do even at home for your child. Because what I always try to enforce with the parents in my practice is a very open communication with me, because I know when a parent is frightened, having that hand holding with their, with me to help, so that they could, help their child heal and recover faster and be their child's doctor, if you will, is so reassuring for them that it's very empowering, I find, and then they feel that, I can do this, so that next time my child gets sick, I'm not so terrified.
Absolutely, absolutely, and I think, I've been sort of a crazy feminist for a long time, even before I was a doctor, treating women, and I think that's something that really gets under my skin, is this idea that women are handing over the most important power, right? Like, who knows better how to take instinctively, primally, intuitively, who knows better how to take care of this little being than a mom? Exactly. And they've been told, no, actually you don't know, and your kid's body is, largely dysfunctional at its operations, and here's how you do it. You need me. You need me, your doctor, and you need this prescription, and you need these, these agents to take over where your kid's body is going wrong. And it ends up being this really insidious way of disempowering moms.
Absolutely.
And, so the way you're talking to these women is really a way to give them back that power and to say, I can help you cultivate a sense of caring for these, caring for your children, even when you feel like you can't do it or you're not the right person to do it.
Right, because what I also try to encourage the families that are in my practice is for them to even understand and even teach the children about sickness and colds and why they get sick, because, when you children are very, very smart. They know what makes them feel good and what doesn't. And so if you can encourage that understanding at a very early age, you will have a child growing into a teen, into an adult, that really will get this sense of empowerment back, that they realize that they don't have to, listen to this, fear or this thought that they can't do or their bodies can't heal without a medication.
Yes, and run to the doctor, every time something feels off.
Exactly.
Yeah. So on that, sort of on that note, for a while now, I don't know, maybe 2 years, Pina and I have similarly aged daughters, and my daughter's about to be 5. And for a while now, when I put her to bed, I do this sort of little, relaxation exercise, and we have this sort of a rhyme. I don't know. Believe me, I have no poetry or musical skills whatsoever, but it's this little thing that I do with her where we talk about the soldiers, quote unquote, and they're basically meant to be her immune system, and we sort of review if there's anything that she feels needs healing or attention in her body, and we'll say, what are the soldiers going to work on tonight, that sort of idea. And I got this idea, I don't know, from something I read about instilling in your kids the idea that their bodies actually do right themselves, right? Like they do heal themselves, they do self-correct, and how important it is to sort of like translate that. So how do you think, you know, for a mom who's totally new to this concept, what are some ways you think that they could possibly communicate this idea to their kids so that they're not, so that their kids, like you said, are not growing up to feel that their health is in many ways buoyed along by prescription medications?
Yeah, I think for me what I found most important is a lot of parent education, is that having parents come in beforehand when they establish care in my practice and have them understand as the parent that even within their own body they have that power, they have that strength, and their body can heal on its own. And so that they can impart that knowledge, just like you're doing with your daughter, to them so that they could do these little, whether poems or tricks, so that when their child gets sick, they do, you know, feel confident. Because I think the biggest thing that, you know, since children are very energetic beings, they will immediately sense when their parent is petrified. And when the parent feels that something's not okay, that's when the child is going to get worried, and that's when, and they don't even have to verbally communicate that. It's just that, you know, energetic connection.
Yeah.
So once you can educate the parent, you know, and I think the biggest issue when it comes to children is the idea of fever, because, you know, many parents have been instilled the fear of God that, oh my gosh, even if your child has a 99 grade fever, that immediately you should give them a medication to suppress the fever. You know, and for me it's really unfortunate that the media has put that out so strongly, or pediatricians have put it out that so strongly, because, you know, what is a fever? A fever is your body's natural way to burn off infection.
Mm-hmm.
So that's what it's supposed to do. Your body temperature rises and it singes it off. And basically you need a temperature between 102 and 103 degrees to defend against these microbes. But again, even something so minor as 99 degrees, they're told, oh, shut it down, shut it down, shut it down, which in effect you're shutting down your child's own immune system, which is making them sicker longer.
Right. And when I started to look into the literature on this, you know, I'm not a pediatrician, but as a very motivated parent, I began, you know, I was really shocked to discover that actually this is not evidence-based medicine, that delivering antipyretics, you know, delivering every time there is a fever, you know, in the hospital we have like a, you know, a certain threshold, and I hear that kids at home are exactly as you said, are being directed to be medicated for lower and lower thresholds, but there's not a clear cutoff by any means above which there are adverse outcomes. Like I think a lot of people have heard that you can have a febrile seizure.
Exactly.
And in fact, there's some very interesting data to suggest that the length and duration of infectious illness is prolonged and protracted, whether it's an ear infection or a cold or upper respiratory infection, with the introduction of you know, fever-blocking elements, and it's probably for the reasons that you're suggesting. So I want to sort of get very practical. I want to remind people that if you want to call in and take advantage of this free clinical advice, go ahead and call in 1-888-874-4888, and let's talk about what you do. So I don't have a thermometer in my house at all. And I've never used Tylenol or Motrin with my kids. I have like a very firm line on this. I don't care what the temperature is. I'm interested, obviously, it's not happened, but I'm interested in the kid, you know, in my kids' sort of like general neurological state. Are they responsive? Are they interactive? Even if they're sort of grumpy, that's a good sign to me. But I'll go as far as to say that I don't think fevers should be medicated, period. So what do you think?
I agree with you 100%. I mean, I think the best thing that I could tell a parent is just to, when they know their child is getting sick or they're really not feeling well, is just check in with yourself and just get a perspective, and doing exactly what you do. It's like you look at your child and you will know, you know what, they're sick, they have a fever, they don't feel well, versus, you know what, this really just doesn't seem right to me.
Mm-hmm.
You know, if it really doesn't seem right, then by all means call your pediatrician and get the care that you feel like you would need. But once you're able to gather that perspective, it really will help you manage your child at home. so that you can, whether do various natural remedies that I'll talk about in a second for your child. So getting that perspective within yourself makes you a very effective home doctor mommy.
It's like you're the thermometer.
Yeah. Exactly. And so
so what are some of the things that you reach for?
Well, the first things that I always do when I know my daughter is getting sick, again, I don't take her temperature either. I will start doing a couple of things. I do a lot of old school natural remedies like hydrotherapy. Water, like if she's having a high fever, then I know either tepid baths or cool compresses to her head will keep a fever, keep her more comfortable.
Mm-hmm.
There are things that doing this these warm foot baths that actually, if you could soak your child's feet in hot water and then you wrap them in a wool blanket, actually what you're doing is that you may actually elevate the fever, but you're more quickly to burn off those infections, and then actually the fever is going to drop. Like your brain is going to sense, our temperature's getting high, we're going to do what we're supposed to, and then it eventually breaks the fever, which is wonderful.
So I love this idea, and I know that anyone who's ever tried it and practitioners who recommend it to patients swear by it. So just run through the details one more time of the socks thing.
So basically, it's called I call it wet sock or warming sock treatment. So what you do is that you want to get very thin socks for your child that fit their feet, and then what you do is you're going to wet them, put them in the freezer, and allow them to get frozen pretty much. Then what you're going to do is that you're going to get your child, and then you want to put them in a warm bath so you could soak their feet or just soak their whole body in a warm tub. And then what you're going to do is put these cold socks on their feet and then immediately put wool socks over them. Then you're going to bundle them up in a wool blanket, so you're like in a little
cocoon.
Little cocoon. And then they wind up going to bed like that, and what winds up happening is that their body will immediately warm up to basically dry as a bone those frozen socks, and then usually by the next morning, your child is about 90% better.
Amazing. Yeah.
Yes.
So, I think I talked at the event that we had about this concept that I really want to be the type of parent who can just sit by and do nothing, because I think that would be like a very evolved state of being and just feel like calm and peaceful. But I definitely am still in the do something about it pragmatic mode, and got this huge supplement cabinet that's basically like my home, quote unquote pharmacy. But I think this is really falls into like this really nice zone between running to the supplements and doing nothing. So it's like this, it's a really, and it's effective. So I think it's a tool that should be in every mom's chest.
Yes, very effective treatment. And I know some other parents feel like they need to give something. So usually then I'd say every parent should have a homeopathy first aid kit in their house. Where you have the basic remedies that, again, if you have a naturopath or a practitioner, because usually obviously kids get sick after hours, so that, when you're calling your practitioner, they could help you decide, or even on your own, which remedy to give. And usually I go by the ABCs, which the first remedy on the onset of the fever is aconitum, and B would be belladonna, and then C would be chamomilla. So even if you don't know anything about homeopathy, where you start dosing your child's fever with aconitum, again, the fever will come down and the child will feel a lot better.
And for those of you who don't know, I'm sure a lot of people listening do know a lot about homeopathy, and for those who don't, I can certainly tell you from my perspective, as somebody who's learned about it late in life. There are people who, like Pina, who have specialized in this and have, an encyclopedic knowledge of it. It's sort of an old-fashioned medicine, right? That uses energetic principles of cellular communication to shift and make changes in the way the body is responding. So it's probably the most gentle medicine there is. It's totally safe for children. I use it for pregnant patients.
Absolutely.
And it can be very complex, and some practitioners will meet with you for 2 hours to decide what's the best remedy, but it does also have very practical usages for acute interventions like this, in what's called clinical homeopathy. And you can get these they're like little tubes, and you can get them at health food stores and Whole Foods, or you can get a kit, like Pina said. So I think it's not to, it's something that should be in everyone's cabinet, even if you don't go further than that. It's an incredible tool.
Right, because you could, in these kits, they're great because they even have first aid remedy because, every child's going to be prone to falling or bumping their head, and there's remedies in there like arnica, which is maybe a more familiar homeopathic remedy. So, again, having something as an immediate first aid that you can do, again, for a parent and even though for myself, is very reassuring.
Yes, absolutely. So anything else?
Yeah, then again, if you're not familiar with homeopathy and you're looking at botanicals, I love elderberry. Mm-hmm. There's a lot of research studies on elderberry syrup, also known as sambucus, that it's even so strong that it's actually effective against the H1N1 virus. So I wish in the media they were talking about that rather than a vaccine.
Don't hold your breath.
Right, yeah. I know. So things like elderberry syrup and echinacea and astragalus and licorice, there are these, you can go again to your local health food store and get these wonderful herbs that are very safe and effective for kids when they're sick.
And normally they're prepared, like I love a brand, Dr. Christopher's, I don't know if,
Mm-hmm.
that's,
sure.
Because they taste good and they're super easy to implement and they're really well thought out formulas. And so, because you can have all the best remedies in the world, and if your kids are not going to take them, then they're not going to be very effective.
Exactly.
So that's an important, thing to consider. So that's great. So there may be a couple of techniques, and then maybe a couple of remedies to have on hand before we jump and run to the doctor. And maybe this overarching idea of trying to stay calm and present, and trying to shed some of the fear around this process because you are convincing yourself that it's part of healing, right? That it's part of, in fact, Dr. Pilevsky, who's one of the experts that we work with at Fearless Parent, talks about how he learned in the old days when he was in medical school about growth spurts intellectually and physically that kids would experience post-infectious. So post-infectious sort of like developmental bursts that they would have after a major infection. And it really argues for this being a natural part of our interaction with our environment, right?
I agree, 100%. I found that with my own daughter. I find that clinically with my patients. It's hugely important to get sick, not only for those reasons, but actually when you boost up your immune system for an infection, you're detoxifying your body, you're training your immune system. So as you go through life, it's actually essential to have these periods where you don't feel well, just for that cleansing aspect and that training of your immune system, within your child.
Absolutely, absolutely. And so you and I both know that part of the battle with health and wellness is prevention, right? So we can talk about all these tricks and tips and remedies, but we also have, I'd be remiss if I didn't pick your brain a little bit about what's the best way to fortify your immune system, to fortify its proper functioning, right? Because we don't just want to boost it. We want it to work correctly so that we don't have allergies and autoimmune disorders, and we also aren't sick all the time. And there are, a lot of sort of like traditional approaches to that, and many of them are through the foods that we eat. So do you think you could sort of enlighten us with what you think are some of the foods that are most important for immune support? So maybe foods that are maybe more important to focus on to counterbalance, as Louise said, the sugar bomb that happens in October. We can maybe start like November 1st to think about these foods, if not earlier.
Absolutely. I think there's prevention is obviously where it's at, especially in where our country is in medical care. So it's for people to get the understanding that they can prevent many of these illnesses beforehand is also great information. And I actually start even with food introduction, when your child is, 6 or 8 months old.
Yes.
So even introducing foods in an appropriate way for your child that, again, that's not going to overburden their body or cause allergies. So once you even start, so I always like to start out early, and then once you've done that appropriately, then it's also about, on the regular day-to-day basis what you're feeding your child. Because
so maybe I'll cut you off, though, because I think this is a really interesting topic for a lot of moms, and I'm sure there are moms listening who have young babies who haven't started eating yet. So what do you think are some of the better foods to start with, maybe some of the sort of like baby superfoods for a 6 to 8 month old?
Yeah, I mean, usually what I tell parents is that if your child has not started cutting their first tooth, then your baby is actually not even ready for food. Because basically the digestive tract is only ready until that child starts cutting. And so what happens, many pediatricians will encourage food introduction at 4 months, and if your child's not ready, or a parent will say, they're constantly spitting it out, it's that they just don't want it. Their body, so honor that and wait until your child is sitting up straight on their own, looking and reaching for your food. So then okay, this actually made good. They have, they're starting to cut their first tooth. Great time to start introducing, because again, if it's done too early, your child is going to be more prone to allergies and eczema and those issues. But to answer, usually some of the superfoods I start with are avocados, yams, beets. On the fruit side, I try to start with vegetables first, of course. Because if you start with fruits, then usually kids don't want the vegetables because they're so much sweeter.
Funny thing about how we're wired,
Yes, it's amazing to sugar. But then if you are going to introduce foods, again, keeping to the more hypoallergenic, like the pears and the applesauce, cherries and blackberries, so more of those higher antioxidant fruits. So I always try to encourage parents to start with that. And then if they notice that if their child has diaper rash or if their stools change color to green or mucousy, then your child is having a reaction to that food. So you want to hold off on it for another month or so and then try to reintroduce it. But so also listen to your child's body as you're introducing those foods.
Okay, that makes a lot of sense.
Yeah.
And so then, as we're thinking about, so there's this idea, which could be, 8 shows in and of itself. So there's this idea of how do we feed, and we will be talking about this every Wednesday pretty much. So how do we feed our kids right so that we can avoid interfacing with the medical system as much as possible? But what about specific foods that come to your mind for their sort of either antimicrobial properties or healing properties, maybe even gut healing, so whether it's nausea and vomiting or diarrhea or cold, flu, and fever, anything that you sort of reflexively reach for in those times?
Absolutely. Basically, I try to keep, I think every child's diet should be obviously organic and whole foods based, low sugar, nothing with colors or dyes or processed. So inherently, if you're keeping your child's diet within that, already you're preventing many of the illnesses and allergic issues. But when it comes to colds and flus, this is why chicken soup is what it is. What I do with my chicken soup is, and I keep it more brothy based because especially when it comes to fevers, you actually want to relax the digestive tract and not force too much food in your child. Because again, many parents get afraid, oh, my child's sick and they're not eating, and so they get afraid. But no, when they're sick, it's actually better to allow their digestive tract to focus on the immune system and keep it light, so broth. So what I do is I make a nice soup with, and I'll put some chicken in there just really for the protein aspect, but then lots of garlic, shiitake mushrooms, onions, parsley, all these things are going to help mount up our immune system, help increase those T cells, and help your child, stave off this flu and infection.
That makes a lot of sense. Yeah, I'm a huge believer in. Also, because I was, my mom is Italian, so I was sort of raised with this idea of the chicken stock, right?
Right.
But as it turns out, investigating the potential benefits of different types of fatty acids. I mean, it happens to have fatty acids that have natural antimicrobial properties. There's sort of a reason that some of these traditions came into being, right? That they actually, once you dig into it from the back end of the science, they make sense. But there's there's observations on a cultural level that they were effective.
Absolutely.
So I would echo that. All right, perfect. So I think we're going to go to questions, actually.
Okay.
There seems to be a couple, so I want to remind people if there's any lingering questions, it's 888-874-4888. Let's see. I'm not sure if they're on the line. Bear with me while I figure out the technical details here. Okay, so it looks like there's John from New Jersey. Are you there?
Yes, I am.
Hi. The
Hi.
wonders of technology. It's amazing. Welcome.
Well, you figured it out. Good for you. First of all, I'd like to say that this is a fabulous format. I mean, really, there's no manual for raising children.
Yes.
And years ago, our parents were using Dr. Spock.
Yes.
How misdirected, you know? But, you know, I wanted to share an idea with you. And by the way, I also think that probably the understanding that people will walk away from after listening to your show is that there are a number of primary providers who should be seen first. Your child should go to somebody like your guest first.
Yes.
There's no invasion, but there's only, you know, an improvement in constitutional health. Now, I'm a chiropractor, and that's what our goal is to raise the constitutional level of health. But here's what we did with our kids. My children were both born at home. They've been under chiropractic care since they were a half hour old.
They're lucky.
They were raised with the idea that they were healthy. They never thought about getting sick. And here's the example. When my son was in the 3rd grade, a lot of the class was absent because they were sick with the flu right after the holidays. And the substitute teacher, who knew me because I took care of her husband, she went over to my son and she said, "Aren't you glad you're not sick?" And he responded by saying, "I don't get sick."
Yeah.
So you see, if you're thinking about things that you could do as a parent and have, like, no job, that's what you want to start with. You want to start with the idea that health is given. The body is really a self-regulating mechanism anyway. And if you just kind of get out of the way, most people get in their own way in terms of their own recovery.
Yes. I couldn't agree more. I think both of us probably couldn't agree more.
Absolutely.
Did you have a specific question for Dr. Pina? Did you want to ask her?
No. I enjoy listening to her. And I'm glad that people are hearing that there are less invasive things that can be done effectively. You know, I mean, homeopathy has been around and successful for a while. East Orange General Hospital used to be the center of homeopathy in New Jersey, and they actually locked up the library.
I mean, it's a paradigm shift that's required, you know, to sort of start to think about who should be our well care providers. And I think certainly as it stands now, you know, people like chiropractors and naturopaths, osteopaths even, and acupuncturists. I mean, there's so many people who are really trained to think about the body differently, and they would probably be a good place to start in terms of true preventive medicine because we just...
Yeah, and you know, one other paradigm shift that's important. If you kissed your child this morning when they woke up or when you left for the day, they were riddled with germs.
Right.
You didn't get sick.
Yeah.
Because germs don't cause disease.
That's right.
Germs don't cause disease. A sick body is a host for disease.
Yes, it's this contagion fear. It makes so much sense to question it. So thanks so much for calling, and I really appreciate your support.
Well, thank you, and keep up the great work.
Thanks, John.
All right, bye-bye.
Okay, I think we have another caller.
Hello?
Hello? Yes.
Hello. Excuse me. I missed a little bit of the front part of the show, so I hope I'm not repeating myself. So forgive me.
No worries.
But I have a child that has gastrointestinal issues, and we were at a dysphagia clinic, and one of the technicians kind of leaned over and said, "Oh my gosh, he's not processing food. He has a very poor, salty, sugary diet." And I thought, you know, it's not that bad. At least he's eating. And then to bring up the big, you know, sugars, after Halloween, my husband and I, of course, were like, "Oh, where's all the Halloween candy? Where is it?" And my husband's like, "Oh, you took it." I'm like, "Oh, John, I did not take that. Where is it?" And then the next morning when I got my son up for school, he was wrapped up, and he had, like, the candy basket from both kids. And I went, "Oh, my God, sugars, and he does have this horrible diet. Well, what am I doing?" But I'm sorry, I'm rambling. But to get back to the clinician at this clinic said that I should look into probiotics for GI health.
Yes.
It's a good doctor, or Allison or Louise, if you could weigh in. She didn't get a chance to finish because she told me, "Oh, this is on the QT, but you should look into probiotics." And I went, "Well, and then I didn't get a chance to get the answer. Are there any recommendations about that with GI health for a very poor, starchy, salty, sugary, addicted diet?
I like that description. At least it's candid. Yeah. Do you want to field that, Tina? Any thoughts about probiotics for gut health?
Absolutely.
That's a big issue. Yes.
It is a big issue and a very important one, and it's unfortunate that she wanted to tell you that it's on the lowdown because it should be common knowledge and something that she shouldn't be ashamed to be saying, because it is a very effective thing that everyone, I think, should be taking. I tell every patient that as part of their daily regimen for health, a probiotic should be part of that, because unfortunately in our culture, fermented foods are not part of it. So this is where we would get probiotics from, naturally within food. But there's tons of research that shows that probiotics, which many people would know as acidophilus, are essential for digestive health. So whether you have any gut disorder, probiotics are important for the healing of it, and not only for the healing of the digestive disorder, but even for our overall immune system. There are many double-blind, placebo-controlled studies that show that with people who took probiotics even twice daily showed significant reductions in the incidence of fever, cough, runny nose. So absolutely, I think it's essential in everybody's health care.
Yeah, and I would just echo what Tina's talking about in broadening the scope even, because it's really at the root, this sort of what we're calling the microbiome, right? This collection of different microbes that exist in the 100 trillion range in our gut. Seems to be sort of where it's at when it comes to the future of medicine. And it takes, it's a really interesting study that suggests that it takes 17 years for what shows up in the scientific literature to translate into clinical practice.
Yes.
So you may be really 17 years ahead of the curve in thinking about using probiotics. And I've shared this tip before, but I have a lot of lacto-fermented foods in my house. These are things you can get at a health food store, things like sauerkraut or pickles. And, my second daughter will eat those things happily, but my first won't. And so I'll just take some of the liquid. You can just pour some of the liquid into whatever other food they're eating. If you're not into supplementing or using supplements, or you feel wary about it, that's a way to introduce beneficial bacteria into their diet. So I think, thanks for calling. And I think Allison actually had a question, so I want to give her the mic.
I have a question about dehydration. So the first thing I want to ask is, could you just go over what the signs are? If your child is actually, you're letting them cook up a really high fever, you've thrown the Motrin in the garbage, and you're just crossing your fingers you're doing the right thing, is there a point where you need to worry about dehydration? And the second way I want to ask this is, I hate Pedialyte. I can't stand this stuff. Right. Is there a way where you could boost electrolytes for your child rather than just regular water? If they're really sick and you're letting their fever get really high, is there a natural electrolyte drink recipe that you can make yourself?
Sure. So let me answer all your questions. Yeah, the biggest concern about getting a high fever is dehydration, especially when your child is little. So you do want to monitor. The best way for a parent is to monitor how frequent that they're urinating. If they really have decreased, because you should basically be urinating 7 to 8 times a day. And if it's really going down, then you want to worry about it. So no matter what, if your child is having a fever where it's 102, 103, 135, one of the tricks that I do with my daughter, because she actually had a really horrific cold last year, that to also answer there, I would give her small teaspoons of fluid literally every 10 minutes, so that within an hour she wound up getting 2 ounces. So it absolutely kept, because my nephew, we were at the same family party, and my nephew ended up in the hospital where my daughter didn't, just by the sheer fact that we were giving her these little teaspoon doses of water every 10 minutes. And whether if it wasn't water, there is a natural way to boost up the electrolytes. One is something called Recharge that you can purchase at a health food store. So that's like basically, instead of Gatorade and these like other colored dyed electrolytes, you can purchase that are more natural. Or there's something called Bieler's broth that you can Google for the recipe. It's Bielers, and basically it's using different vegetables, making your own broth, which will also increase electrolytes, which is wonderful.
And what do you think about coconut water?
Coconut water you could do also.
Okay, yeah, because I have that in my arsenal. I mean, how many more options do you need?
No, I mean, again, you do have
great.
a lot of alternatives. So,
yeah,
and I think
so
for
many
parents,
choices.
The key is to keep those fluids up, especially with a fever, for dehydration. So, again, if your child has been, even for vomiting or diarrhea, if that's the type of cold that they have, not making your kid drink this large amount just because you're scared, they're just going to throw it back up again, or it'll go right through them. So doing these smaller dosages and diligently will help keep them hydrated and definitely out of the doctor's office or the hospital.
Makes so much sense. So if there's anyone who didn't get a chance to ask a question on fearless-parent.com, on the radio blog, you'll be able to ask questions that we can field. And if there are any comments, then you'll get one of Dr. Pina's very handy handouts. And so I think that'll be an incredible tool for navigating these next couple of months. So Pina, how can people connect with you? How can they learn more about you? How can they follow what you're up to?
Sure. We have a website, which is www.innersourcehealth. That's INNERSOURCE health. And then on there, you could also read our blogs. We also have a newsletter that you could sign up for free. We obviously don't sell it. We just try to put out good information monthly. We're also on Facebook and Twitter. So all those places, either for my name directly or for Inner Source Health, you can get some great information. And if you need to call, it's 631-421-1848.
Amazing. And she's an incredible asset if you're in the community, and I highly recommend following her information. I do personally, and brilliant. So thank you so much for coming on.
Kelly, it's my honor and pleasure.
Thank you. I'm going to hand it back over to Allison and Louise. Stay tuned for next month. We're going to be talking about ultrasound. What's the deal with ultrasound in pregnancy? So follow us.
Thank you so much, Kelly and Pina. This was really terrific. I know that a lot of parents are listening, and what I got from this was, listen to our intuition. There's a lot of accumulated instinct and knowledge and experience that if we allow ourselves to be quiet enough to be in touch with, we know the best things to do for our kids. So, just outstanding. Allison, are you there?
I am. I'm just sitting here. There was so much good stuff to think about coming out of that. I'm 17 years from research to practice. How about that one, Louise?
Yeah, I know, right? I know. So, I have to just say this one thing, and then we'll go to close because, God, the time is up already. But, when I heard both of these women, right, professional women, deeply trained, using a lot of very technical words around things that a lot of moms are just doing naturally. One of the things that Kelly said was that the use of Tylenol and Motrin, right, antipyretics, for fever, it's not evidence-based medicine. Isn't that, that's just stunning to me. And yet that is what everybody is trained to do, is to reach into that cabinet. So, everybody, we look forward to having Dr. Kelly back next month. And, please give us your suggestions for show ideas that you want with Kelly and just for our weekly show for me and Allison, too. So, okay, so as Kelly said, we're going to keep the conversation going on our website, fearlessparent.org or fearless-parent.com. You can get to us both ways there. And Kelly will answer any of the comments and questions that you have, and then you'll also get Dr. Pina's Colds for Kids handout. So, Allison, you want to tell them about next week?
Yeah, next week, while you're getting all of your Thanksgiving stuff together in the kitchen on Wednesday, you'll have a chance to get to know Kelly better. You can listen to a show that Louise and I taped with Kelly a few weeks ago and got to ask her all kinds of nosy questions about what it's like to be a doctor and a mom.
Awesome, right? So, and then just a quick plug for our December 4th show. We're going to be talking with educator and author Janine Caffrey. She's got this book that Allison and I are just devouring. It's called Drive. And Allison and I both have 12-year-olds, and let me tell you what, this is the perfect book for parents of tweens and teens. And no, it's not about cars. It's about motivation. And how by giving our kids everything, they want nothing, right? If we give them everything, we take away the wanting, the fire in the belly that is what really pushes us to achieve. So we're doing them a great disservice. Okay, so thank you, everybody, for joining me and my co-host, Allison McNeil, on Fearless Parent Radio. We hope that you'll become a regular listener. You can always find our show on prn.fm and on iTunes. In the name of who and what you love, be fearless. This is Louise Kuo-Habakis.
And this is Allison McNeil.
Have a great week. See you next Wednesday.
Say my name.